Running?
Yes.
Madam Clerk, I'm going to call the Health and Human Services Committee of the Wayne County Commission to order. Would you do the roll, please?
Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Baker McCormick.
Here.
Chair Colleen.
Yeah, here.
You have a quorum present.
Thank you. Next item on the agenda, Madam Clerk.
B, approval of the September 29, 2020 meeting minutes.
Pleasure of the committee.
Moved. So moved.
Support.
That sound like Baker
Dobb.
McCormick. Yep, and Dobb. Any additions, changes, corrections to the minutes? Hearing none, all in favor of the motion, please say aye.
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 Opposed, please say nay. Okay, Madam Clerk, what's up next?
C, old business. Item 1, a resolution by Commissioner Baker McCormick strongly urging that all children in Wayne County be tested for levels of lead in their system, that data sharing be implemented so that all partners throughout the county and state of Michigan can better coordinate prevention and lead remediation services, and that the lead renovation, repair, painting program be enforced.
That sounds good. Vice Chair Baker McCormick, this is your resolution.
I
What
move
do you want?
approval
Okay,
of this resolution, and we discussed this in the full board. We made sure that the lead-based ordinance and also this resolution worked in tandem. This resolution really focuses on the remediation of lead and making sure that our various agencies in the state, city government work together hand in hand in preventing lead poisoning and testing in particular for young people or young children under the age of 6 without them having to be a low income household. And I move support of this resolution.
thank you. It's been moved. Is there support?
I'll support Dobb.
Thank you. Any discussion of this resolution? Better start looking and see if I got hands up. I don't hear any discussion. I want to thank Commissioner Baker McCormick for moving this forward. Any discussion? All right, we're ready for a vote. All in favor of the motion to adopt this resolution, please say aye.
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 Aye. Aye.
Anyone opposed, please say nay. Are there any abstentions? All right. Madam Clerk, I believe we're moving to the addenda.
You want to go to the addenda first and move those before the agenda items?
Yeah, we'll get to public comment and such other matters when we're done with the addenda.
Oh, we have a new business item for the agenda. Did you want to do that first?
I forgot about that. Yes, new business 1. We're not on the addenda yet. Right. We got to get that CBPC in. Madam Clerk?
Item D1 and a new business, requesting commission approval of a grant with the Michigan Department of Health and Human Services.
Excellent. So almost $1 million of unexpected COVID relief money. Who's with the administration that's introducing this, please? Anybody from administration that can talk about the coronavirus relief fund and what we're doing with it? All right. Let me see who's in the meeting, start calling names.
Hi, Commissioner Clean. I'm sorry. This is Carol.
Very good. Name and title for the record, and please introduce
Yes,
us.
yes. Hi, this is Carol Osterbury. I'm the health officer with the Wayne County Health, Human and Veteran Services Department.
Thank you.
I
What's up?
just had to unmute there. I apologize.
That's all right. Don't worry. We're rolling.
Yes, this is our annual CPBC
No,
contract.
we're on item one. I'm sorry. I messed up. This item is the 900, almost $1 million worth of COVID.
Got it.
Yep.
Okay. Yep. Okay. So this money came to us literally on September the 15th, and we were told we had to spend the money by September the 30th. So this money, so then long story short, talked with administration, talked with the state, and we were given approval, which we got all in writing, for spending all of this money on a comprehensive advertising community engagement campaign, specifically, for, our communities that are, we've been seeing increased numbers of COVID-19. The big parts of our message, when the health department calls, pick up the phone. All of the good, strategies for still social distancing, wearing masks, not, being in gatherings with more than 10 people. All of these messages are going out into the communities in Wayne County, but we are also targeting the communities which we're able to track through our daily COVID new case numbers into those communities where we're seeing increased numbers.
All righty. Thank you. Discussion from committee. So I guess this is technically a retroactive then? We've already spent the money?
Well, right. I'm working, obviously the health department, and then we are working very, very closely with the director of communications on this whole plan. And so the money, yes, has been, and that was allowed because with advertising, you have to, do those purchases up front and then, PSAs and, all of that happens. So that was why this was an allowable expense and an allowable way to spend this money with such a short time.
Okay. We'll go around the horn for questions for committee members. I guess, Commissioner Marecki, do you have any questions on this item?
No.
Commissioner
Thank you.
Dobb?
No questions. Thank you.
Yep, thank you. Commissioner Anderson?
Yes, Carol, I just have a question for Carol about this very thing I realize the component of public information is very important. We've been experiencing, I know in the daily report that's sent out, Dearborn seems to be the highest, consistently higher than any of the other communities. Could you give us an update on that? What is being done to try to tackle that issue?
Yes, that's a very good question. And, everything from the, to be honest, many of the households in Dearborn are multi-generational and, have, many, members of the same family all living in the same household. We're finding that. We are finding also with, there are some language, translation issues. So we are also working with this campaign and then through our contact tracers to hire individuals who are bilingual. If you get a call from the health department and, there could be a language barrier, that just makes that whole interview process a little more difficult, on both ends, frustrating on both ends. We are also, doing everything from, to be honest, that community is a community where, they're close-knit, they're, like I said, lots of, family units. And so it's working with everyone from, the youth on, up to the, parents and elders as far as the messages of, because we're seeing more of the, I want to say like 18 to 23-year-old, And so, really messaging to them, if you get COVID, but you're bringing it home to your, to your family, many times to elderly members of your family, and the risk, that health risk. So, like I say, and then, wear your masks, wash your hands. Don't be, with large, groups of friends and, family. All of those messages, and again, in multiple languages, is that approach to going out and, getting the word out. Oh, and then also the last piece has been really a door-to-door campaign with the businesses, making sure our business owners in that community understand, the executive orders for capacity limits. And, indoors it was at, 10 individuals, outdoors, in the outdoor seating, so we actually were doing all of that mid to late summer, right door to door in the businesses. Here's a flyer, explains everything. So yes, and the faith-based also have been part of that, right door to door campaign for information about COVID, what is allowed, what are safe practices.
Are they employing also maybe Arabic billboards, messages to
Yeah. Yes.
Okay.
Mm-hmm.
Yeah, I think we are certainly thankful that a lot of these constant high numbers of infection rates haven't turned into additional deaths, and the death rate certainly is down across the board. But I think the infections, that's still something for us to be really concerned about.
Yes, and we do watch that, very closely and carefully, every day with our, daily reports. Absolutely.
Right. Thank you. Thank you so much. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Baker McCormick, you have questions on this item?
Well, not really on this item, but just wanting to know, because of the current ruling from the Supreme Court on the governor's executive order, how, if any way, would this affect what you're doing, the new order, or the lack thereof, I guess?
Right. Yeah, very good question. And yes, we have been meeting obviously very closely with administration, executive's office and corporation counsel on, all of this, and making sure that what is coming from the state, the Supreme Court opinion, and then yesterday the State Department of Health and Human Services, they actually then reissued orders under the authority of the director of Michigan Department of Health and Human Services, and we are still reviewing to ensure that those orders are effective for any sort of enforcement for, because we all agree, we are in the middle of this pandemic, and wearing masks and socially distancing and capacity limits, indoors and outdoors, those are all still very important public health protective, measures that need to be taken by all of us in the public. And so those orders need to be in place, for the residents of Wayne County, the residents of the state. Yes, we are staying on top of all of this and have been since, Friday evening.
And so I think the public is a little confused as to what it really means, what the new order or lack thereof, an order, and each municipality or county having their own way of doing things. I'm just wondering how do we get or continue to get the word out that we still have some guidelines of wearing masks or whatever each, I guess, or whatever Wayne County is going to, or whatever Wayne County position is going forward.
Correct. Right, correct. And a statement did go out from communications, obviously working very closely with them to make sure it is an accurate, correct, and, statement, like you're saying, as far as what is the status, what is the authority. And, I think, Commissioner, you bring up a very good point as far as all of us in the state and, the county, we all want consistency. I don't think any of us want to be in Wayne County and then go to Macomb County and have a completely different set of rules, and then go to, Oakland County or Livingston and again have different, that just does not, that is confusing to the public. It's, very inconsistent, and also, again, it does not, unite, all of the actions that we've been taking for so many weeks and months to truly, combat this, respond to this pandemic, the mitigation measures. So, certainly all of your points are things that we all have been thinking and working on, and it is that united message through our, Chief Communications, department.
Thank you.
You're welcome.
Mr. Chair, to that point,
Yes, please, Commissioner Marecki.
Carol, okay, with all this, kind of confusion the last few days, I guess my question is this, and believe me, I don't have problems with the masks. I don't have any of those problems. But what is the end game? Are there discussions about what the end game with this is? In March, we were told we were going to lighten up the hospitals so they weren't overwhelmed. This is going on and on and on because, of course, when you open back up, people are going to get the virus and you can't stay completely closed down for the rest of your lives. But I think the public needs to know what the end game is. And I not necessarily from us, from even higher leaders than the county, is it we're going to do this to you until the vaccine comes out and everybody gets the vaccine? I don't see an end to this. And every week, it's, there's still businesses shut down that are gone. They're losing their entire businesses. But do you guys ever had to have discussions with the state with this or amongst yourselves? Because I just think it's very confusing to the public that we're having rare deaths right now. We have people getting it, but people aren't dying, and there's nothing coming for the future. So I just want to know if you discuss that.
Right. It's really, what ends this pandemic? And, that is what we're all obviously striving for. And like you say, when, a vaccine comes out and then getting, more of the public, vaccinated. And so then, having the immunity to, an infection of COVID-19 again continues to lower that, that death and the hospital admissions. And the other piece is that scientists are working on very diligently is that proven clinical therapeutic course of action, so that when an individual is diagnosed with COVID-19, then if there is, very prescribed, this is what is the known, pharmaceutical intervention so that you don't have, that horrible outcome from having gotten COVID-19. That is the other indicator that, the pandemic is over. We are, like you said, we're doing all of these mitigation measures, and there are, medications out there that are, still considered in trial or experimental. The vaccine is still in the trial phases. So that's why this is still considered, we are still in the phase of COVID-19, pandemic, because we don't have those other pieces. like I said, I look every day. That's what I do, is I look at the number of, new cases, the number of deaths, and, I'm very happy that we certainly don't have the deaths like we did, when this all first, came to our community.
Yeah, I know you guys have done an awesome job, but the thing is too, is with treatment, it's a very individualized. I mean, it looks like there's being different drugs being tried on different people. And so I'm not even sure that will ever be pure protocol, because some people, have different things. And then the other thing is, I don't know if you've seen some of the polls that they've done where people have said if a vaccine comes out, there's no way in heck they're getting it at the beginning, like feeling like they're guinea pigs, because a lot of times these vaccines are tested for a while. So I don't know. I just,
Right.
I think people are going to really start getting antsy and asking more questions about, we've been doing this for months and months and months, and now 10 people a day are dying in the state. Some of those aren't even dying in the state, but they're catch up from other days like we've talked about in the past. And, the businesses are just floundering, even, the 50% in the restaurants. I mean, they can't keep making it like this. So I guess that's just my thought. And thank you for your explanation. But I think people are going to start to really be held accountable on what we are really doing for an end game. But thank you. And thank you for letting me talk, Mr. Chair.
Oh, no, I
Thank
appreciate
you,
it.
Commissioner. I'm going to give Commission Counsel Felicia Johnson a little bit of a heads up here to unmute yourself. Counselor, from a legal perspective, given what the Supreme Court did a few days ago, the Michigan Supreme Court, I don't know anybody that's not confused by what that means and what the way forward is. Just briefly, because we're really drifting away from the topic here a little bit of the vote that's before us. But Commission Counsel Felicia Johnson, is this the case everywhere, that everyone's trying to make heads and tails out of what the Supreme Court said the other day?
Through the chair, I think that the ultimate order of the Supreme Court, meaning that the governor no longer has, as of April 30th, the authority to issue the orders for emergency, or to actually act upon her emergency powers anymore, is pretty clear. I think a lot of the confusion that you currently see when what people are trying to figure out relates to the timing of the effectiveness of that order. And that's
Right.
why the governor filed that motion. And then also, I believe, just from a local level and even a state level, what to do. Like if the court, since the court has said she doesn't have that authority based on the statutes that she was relying on, then the question becomes, then what do we do to actually put the proper protections in place? And as you see, they already issued one order through the state HHS department, as Carol mentioned. And so then I think that just having the local health departments look at, okay, if the state, where does the state currently have effective orders, and then seeing where on the local level, everyone can then fill in what they believe are gaps. And then to do so in a uniform manner so that you don't have the public confused because you go to one county and we do one thing and the next county is something different. So I think regional coordination and figuring out what is still valid and how to fill the gaps where the state doesn't ultimately fill them is probably where the confusion rests at this point. But the ultimate decision of the court, I think, is fairly clear.
Okay. Counselor, but the court order didn't say that all the locals have to walk in lockstep, right? I mean, that's what makes sense, but that's not ordered by the court, because Oakland County just came out with something yesterday. It just seems to me that there's going to be lawsuits, counter lawsuits. The confusion around this is not going to end anytime soon. I guess that's the feeling I have. Okay, we got
To that point, can I
Yeah, please,
ask a
Commissioner
question? Felicia, so what's going on as far as, because I've actually gotten a couple of emails today from groups that are under the Open Meetings Act. Has there been, are we waiting until the end of what did you say? It's October. This is going on with the governor till October 20th, did you say?
Commissioner, that depends on several factors, and that's a discussion we can have offline.
Okay.
It really does. It depends on, you know, if the court rules and what they rule on the motion that the governor ordered. There's still a federal lawsuit that started this. The federal court could do something. There are several different interpretations of the effective date of the Supreme Court order that came out on Friday. So that's the confusing part, and that's the moving target that I think everyone's trying to figure out, along with just ensuring that, you know, the local governments and public health officers actually protect, you know, your constituents in the communities. So there are a lot of moving parts here. And I would gladly have that discussion with you to try to get into the nitty-gritty about, you know, what could potentially happen. But at this point, it's so many moving parts, it's hard to tell you exactly how this will play out as far as timing. So while I can tell you you'll be on Zoom likely tomorrow, I can't tell you beyond that because I just don't know what may or may not happen.
Okay. Yeah, I was just wondering about the Open Meetings Act because some groups are feeling like they need to go back, that they're not covered by that at this point. So we're still working it out, obviously. Thank you.
Yeah, still a lot of moving parts and questions.
Okay, thanks. Thank you.
And they will continue to move regardless of any court order. The moving parts will continue to move.
Yeah.
Okay, we have an item in front of us to accept a $944,999 grant from the state of Michigan to use on public messaging for COVID outreach. What's the pleasure of the committee?
Move approval. Dobbs.
Thank you. Thank you. And the support was?
Marecki.
Anderson.
Oh,
Marecki.
sorry.
It was Marecki. Okay, we got it. Any further discussion on this item? All right, all in favor of the motion, please say aye.
Aye.
Aye. Opposed, please say nay. Abstentions. All right, Madam Clerk, I think we can go to the addenda now, and our health officer can be prepared to talk about the CPBC or whatever. Madam Clerk, what's next?
Item 2 on the addenda, requesting commission approval and acceptance of funding for the fiscal year 2021 Local Health Department Comprehensive Agreement with the Michigan Department of Health and Human Services.
Ms. Osterberry, would you like to pick up now that the chair is not misleading you where on the agenda we're at?
Yes, so this is our annual CPBC contract that we get every year. And again, it is, we've gotten increased funding because of the, for COVID-19 response. And that's why this is, usually it's more around 10, maybe almost 11 million. But that's where the extra money has come from.
Ms. Osterberry, is that $1 million we just approved a part of the CBPC, the comprehensive budgeting and whatever? Is that million that we just approved part of this?
No, because that was from last fiscal year.
Okay. Do you want to describe just a little bit where the extra $3 million or so is going that we had not received in the past?
Right. We are hiring a whole additional team of case investigator, contact tracers, like I was discussing there with, and, folks who are also bilingual. We are also, there's some money to help with our testing, our pop-up testing events that we're having out in the community, for everything from supplies. And actually, that money actually includes money for us to purchase a couple of vehicles, cargo vans, to help, because every time we go out on these events, we load up a van load of, equipment and supplies. We also are able to increase just, to be honest with a lot of this, there's been a whole lot of printing that we've had to, do, just for all of our education, outreach, posters, fact sheets, so printing, it adds up very quickly. those are some of the really key, expenses that we are using this additional money, on for our COVID-19 response. Oh, and the last thing is any, the medical supplies that we can purchase, now in preparation then even for then the vaccine. There are supplies that we can purchase, that do not expire. So we will have all of those items in place for when the vaccine comes out.
All righty. Thank you for that. We'll go to questions from commissioners. Go around the horn here. Commissioner Marecki, would you like to kick it off?
I am fine, thank you.
All righty. Thank you. Commissioner Dodd.
No questions, thank you.
Thank you. Commissioner Anderson, any questions?
No questions, thanks.
And batting cleanup, Vice Chair Baker McCormick, questions?
No questions, thank you.
Okay. 2 weeks from today, and Ms. Osterberry, I'm going to email you today. We talked at the last meeting how we haven't really had a COVID update for a couple of meetings now from our health officer. So I'll deal with that offline with you, but I also want to say to my colleagues, anything that you want the health officer to be reporting on 2 weeks from now, please send me an email on that so I can get that to them so they can be prepared ahead of time and we don't catch them flat-footed on any issues that are of importance to the Wayne County Commission. So please, my colleagues, send me a email with any topics you want covered. Okay, the item before us, what's the pleasure of the committee?
I'll move approval, Dobb.
Thank you, Commissioner.
Support.
Thank you, Commissioner Marecki. It's been properly moved and supported. One last time for any questions. Hearing none, we go to a vote. All in favor of the motion, please say aye.
Aye.
Aye. Opposed, please say nay. And are there any abstentions? All right, thank you. That passes. Madam Clerk, what's next on the agenda?
Item 3, requesting commission approval of modification 1 to a 3-year grant award with the Senior Alliance.
Okay, and I believe our senior boss is on the line or somewhere in this Zoom thing.
Yes, good afternoon, Commissioner Colleen, and to the complete committee. Good afternoon. It's a pleasure to be here. I'm joined today with my Division Director, Joan Sarakas. So we're a tag team today, Chair Colleen.
Hey, thank you, Ms. Whitmore Davis. It's good to see you.
Good to see you.
At least in the photo.
Thank you. Thank you. Yes, we have the main thing is a increase to our budget because of the increase. We're serving more folks, as I have reported to this committee, and also to the senior task seniors and veterans task force that we have during this COVID time increased our serving numbers and quantities to the older adults in Wayne County. Joan, would you like to give more insight on that?
Thank you, Lisa. Good morning, commissioners. Yes, and as we have reported throughout this COVID crisis, additional seniors have been requesting meals. We currently are providing about 2,600 per day, and we are delivering the modified version of our Meals on Wheels. A 5-pack frozen meal package is being delivered each Monday to all of our home delivered meal clients. Our congregate meal clients are also picking up 5 packs on Monday, and our liquid nutrition clients continue to get their 1 month's worth of liquid on a monthly basis.
Thank you, ma'am. Would you identify yourself, your title for the record?
Joan Savrakis, Division Director, Wayne County Senior Services. Thank you.
Thank you. And we will go to questions from commissioners, starting with Commissioner Marecki.
Oh, sounds good. Thank you.
Thank you, Commissioner Baker, or Commissioner Dobb.
I have no questions. Thank you.
Hey, Commissioner Anderson.
None now. None at this time.
And batting cleanup, Commissioner Baker McCormick.
No questions, thank you.
Okay, what's the pleasure of the committee?
Move for
I'll move-
approval.
I'll support. Dobb.
Anderson, supported by Dobb, has moved to approve. Proper motion before us. All in favor of the motion, please say aye.
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 Opposed, please say nay. Any abstentions? All right, Madam Clerk, what's next on the agenda?
Commissioner, if I
I'm
may,
sorry,
please.
Miss.
I'm
Yes.
sorry. I just wanted to make you aware, we had a item that almost made the addenda today for Valley Services contract amendment for our.
I heard about that, yeah.
Yes, sir. And so I just wanted to mention that we may be requesting immediate consideration and hopefully get this item before you as soon as possible. So I just wanted to make you aware of that forthcoming.
I appreciate the heads up on that. Thank you, Ms. Servaxis. Yeah,
Thank you. Thank you,
thank you.
Commissioner.
Yeah. All right. Madam Clerk, what's next on the agenda?
Item 4, requesting commission approval of modification 1 to a 3-year contract with two one-year options to renew with house arrest services.
All righty. And who do we have from administration on this? This is for our youth that are not being incarcerated, but instead they're in the community. Who's introducing this, please?
Good afternoon. This is Shanetta Coleman, Division Director for Health, Human, and Veteran Services.
Welcome, Dr. Coleman.
Thank you. So what you have before you is our electronic monitoring contract, and the request here is to increase that contract to allow us to continue to serve the initial intended probationers who may be on a tether as opposed to being detained in the Wayne County Juvenile Detention Facility. What we have here is a need to increase that as a result of more youth being placed on tether or electronic monitoring. And we saw a major increase in the number of youth that were placed on tether as a result of COVID. We reduced the population in our juvenile detention facility in an effort to minimize any potential for any spread of COVID. And so the court actually increased the number of youth who were able to return back to the community using electronic monitoring.
All righty. Thank you. We'll go to commissioners' questions on this item. Commissioner Marecki, why don't we lead off with you?
Yeah, I don't have any questions on this.
Okay.
It's good stuff. Yeah.
Thank you. Commissioner Dobb?
Just one quick question. So you said you reduced the population at the juvenile detention facility, but there are still juveniles being housed there. Is that correct?
That would be correct.
Okay. All right. That's all I had. Thank you.
You're welcome.
Thank you, Commissioner. Commissioner Anderson?
None at this time.
All right. And Vice Chair Baker McCormick?
No questions.
All righty. Thank you. Dr. Coleman, can you give us numbers, more specific numbers on that? Like a year ago, how many kids do we have in the juvenile detention facility and how many are there today?
Sure. So that population generally changes daily, but on average, last year we probably had mid-80s, so anywhere between 80 to 85 residents at any given time. At the point that COVID hit, we had high 70s. I want to say it was about 76. In an effort to reduce that population, it dropped all the way down to about 44. So almost in half. And it has crept up a little bit, but we are moving kids faster. So we don't have as many kids. So today, I think we have a population of 61. So we've been maintaining a low population so that we can continue to try and ensure that kids who should be detained, who have more serious offenses, are detained, and those who can be returned safely back to the community, and where we can use electronic monitoring, that we're able to do that.
Okay, thank you. So this is a active conversation on each case between the department and the juvenile courts?
Yes, the juvenile courts and our juvenile detention facility has been also as part of the virtual coordination with these tethers. We've been doing a lot of virtual courts.
Sure, especially if somebody has been a guest in the juvenile detention facility. Of course, they would have to weigh in prior to a tether. Okay, pleasure of the committee on this one.
So moved.
Thank you, Commissioner Baker McCormick.
Ward Anderson.
And Anderson supports. All right, properly moved and seconded. All in favor of the motion, please say aye.
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 Thank you all.
Opposed to the motion, please say nay. Are there any abstentions? All righty, motion passes, and thank you, Dr. Coleman. Madam Clerk, what's next on the agenda?
E, such other matters as may be properly submitted before the committee.
Does anybody have some such other matters?
I do, Chairman. This is Felicia.
Please, Commission Counsel.
So my apologies. I think I was having some technical difficulties and I missed the motion that was made for the resolution, but I'm told that it was not moved as amended. And as Commissioner had indicated, and as was stated at full board, we made several amendments to it.
That's correct.
And we want to make sure that we're moving the correct item out of committee so that we don't have any issues at full board. So I'm going to kindly ask this body to make a motion to reconsider, I think it was C1, the resolution, and then make a new motion to actually move it as amended with all of the changes that were made that Commissioner had mentioned.
You say friendly, but boy, that sounds aggressive. Would anybody like to? Move reconsideration of item 1 on our agenda today?
I move for reconsideration of item number 1.
Okay, and I think I heard Commissioner
Baker McCormick.
Yeah, I heard that.
Support.
But Marecki, that's what I thought supported. All in favor of reconsidering item number 1, please say aye.
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 Aye. Opposed? Abstentions? Baker McCormick, I'll call on Commissioner Baker McCormick. I'll call on you for a motion, please.
I move to amend.
No, move as amended.
Move as amended the resolution, the lead resolution.
Council, you good with that motion?
Move as amended, right?
Yes.
Okay.
I will support as amended.
And Commissioner Dobbs supports. All in favor of the motion before us, please say aye.
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 Opposed? Say nay. Abstentions? All right. Thank you, Commission Counsel. Back to the clerk. We're still on such other matters. Anybody like to bring some other matter before the committee right now? Hearing none, seeing none. What's next, Madam Clerk?
Public comments.
Do we have any email public comment that has come in?
No, we haven't received any emails.
Okay. Do we know if anybody on the phone would like to have, or in the Zoom would like to have public comment? Public comment is hard to do in Zoom times. Any member of the public wish to address the Health and Human Services Committee of the Wayne County Commission? Any member of the public? Hearing none, Madam Clerk, what's next on the agenda?
Adjournment.
Move to adjourn.
Ward Anderson.
Moved and supported without objection. We stand adjourned. Thank you, everyone.